So this question is about a 36-year-old African American who presents with complaints of shortness of breath exacerbated on walking. So he's describing exertional shortness of breath. From 2 months, he also complains of joint pains and recently received treatment from ophthalmologist in view of anterior uveitis. He's not diabetic, not hypertensive, vitals are stable. On examination, there is bilateral parotid swelling, bilateral parotid swelling, and multiple erythematous nodules are present over shin and elbow, so he's describing erythema nodosum. Auscultation revealed bilateral fine inspiratory crackles, crepitations. Chest X-ray revealed the following findings. So ACE levels are elevated. That's a very important clue. CT guided lung biopsy is more likely to show. This is a pretty straightforward question. This is an entire symptom complex of a disease called sarcoidosis, which is an autoimmune disease, and genetically predisposed individuals develop, especially in specific races like African Americans, this is more commonly seen. So people who present with sarcoidosis typically complain of swollen parotid glands, and on examination you can see swollen lymph nodes in the neck and in the chest, mediastinal nodes. And they also complain of constitutional symptoms like weight loss, anorexia, joint pains like here, and also due to the lung symptoms, you can see dry cough, shortness of breath, wheeze, and erythema nodosum. These are the typical symptoms of sarcoidosis. So in this disease, there will be increased ACE levels, and you can see on biopsy some granulomatous lesions which are non-caseating. If it is caseating granulomatous lesions, then it would be tuberculosis, but here it is non-caseating granulomatous lesions. In these lesions develop in almost all organs, but more specifically and predominantly you can see these lesions in the lungs, other organs as well. So let us look at what he's asking for. So biopsy would most likely show. Answer would be acute inflammatory infiltrates, because you know the stages and types of inflammation. Granulomatous lesions are inflammatory lesions. So that would be the option, the correct option here. Let us look at the other options. Widened air spaces, it means emphysema. So widened air spaces are seen in emphysema and in alpha-1 antitrypsin deficiency. You can also see this when it is associated with cirrhosis in the liver. Mucus plugging is seen when the secretions are not properly cleared. It is most commonly seen in asthma. You can also see this in cystic fibrosis or in diseases where the secretions are not cleared properly, like in Cartageners. So the next option is golden brown fusiform rods resembling dumbbells. He's basically describing a chronic lung disease where golden brown fusiform rods, these are foreign bodies. So he's describing asbestosis. Intraalveolar hyaline membranes, it is seen in ARDS, where in infants due to decreased production of surfactant due to prematurity or due to any other predisposing condition, the hyaline membranes form in between the surfaces of alveoli or the terminal bronchioles. So there would not be proper exchange of gases due to the buildup of these hyaline membranes and proteinaceous debris. So that is describing ARDS. The last option is fibrosis. So fibrosis is caused by certain drugs like methotrexate and nitrofurantoin. It's important if you can remember these two drugs most commonly causing fibrosis of the lung. Even idiopathic fibrosis of the lung can occur, or due to radiation also fibrosis can occur.